Professor Emma Duncan, head of clinical endocrinology at King's College London, said, "There is evidence that men who are recovering from moderately severe COVID-19 have reduced sperm quality and counts, 1 to 2 months after their illness. This is in comparison to men who have a mild or asymptomatic infection with SARS-CoV-2, the notorious coronavirus." Professor Duncan pointed out that sperm production may recover with time. For those concerned the COVID vaccines could affect male fertility, Professor Duncan shares her words of wisdom. The question of male fertility and COVID-19 vaccines has been studied for mRNA vaccines, and there is no evidence that sperm counts or motility, sperm capability to move/swim, or male fertility are affected by vaccination. Therefore, the scientist recommends all men who are planning for a family to get vaccinated. This is for their own sake and for the sake of their partner. For expectant mothers, or those planning on falling pregnant anytime soon, Professor Duncan highlighted current findings. COVID-19 in pregnancy, particularly late in pregnancy, is associated with a higher chance of adverse outcomes for both the mother and the baby. There is no evidence that vaccination affects fertility of either men or women. Where you live in England may determine your risk of dying from COVID. New study vitamin B12 deficiency, 3 symptoms that can lead to nerve damage, what to look for. Expert cutting down on calories can boost longevity, but how much should you cut back? Study. Thus far, the number of people in the UK who have been vaccinated has reached more than 48 million. While the latest government data shows that COVID cases are continuing to increase, the number of COVID deaths and patients admitted to hospital has decreased. These statistics reflect the success of the vaccination program. While the COVID vaccines cannot stop you from catching the disease, it can reduce the risk of severe disease, hospitalization, and death. There are knock-on effects of reducing the number of patients admitted to hospital too. With less COVID patients requiring hospitalization, the NHS are better able to attend to the needs of other patients. Just because coronavirus has had a devastating impact on the world, including the UK, other diseases still exist. By reducing the number of COVID patients, medical staff can focus on helping people diagnose and treat cancer, for example. If you have still not had a COVID vaccine, walk-in centres are dotted around the UK. Find your nearest one here. People are required to have 2 COVID vaccines to receive the best protection from the virus. As with any type of COVID vaccine, mild side effects are to be expected. The NHS stated that side effects could include a sore arm from the injection, feeling tired, a headache, feeling achy, or being sick.